As we learn more about this virus, the response evolves too, and your questions about it keep coming. Jeff Semple has the answers to some more of them tonight.
One of the latest COVID-19 cases caught even health experts by surprise.
It surprised everyone because that hadn't been documented before.
This tiger at New York City's Bronx Zoo, the first animal in North America to test positive, leaving many cat owners curious.
My name's Melody Turtenrud. I'm from Revelstoke, BC, and I'm just wondering about the transmission between animals and pets and humans.
Coronaviruses have long lived in animals, often originating in bats. Several strains, including MERS and SARS, have then made the leap to humans. And in a small number of COVID-19 cases, humans have then infected felines and dogs.
But there isn't clear evidence that the dogs, for example, can transmit to humans.
Strangely, none of the staff members at the zoo has reported any symptoms, leading viewers to ask this.
This is Lena in Ottawa. My question is about the transmission of COVID-19 by asymptomatic carriers.
Iceland tested nearly 5% of its population, regardless of whether they had symptoms, and nearly half of those who tested positive were asymptomatic.
And we've heard about transmission of this infection in people that are going to develop symptoms but haven't yet developed symptoms yet. It's unclear to what extent that's happening in the community.
That uncertainty prompted Canada's top doctor to change course, advising people even without symptoms to consider wearing non-medical homemade masks.
Hello, my name is Kelly McCallum and I live in Morinville, Alberta. Many of these masks are designed with a pocket to hold a filter in them, and the suggestions vary from using a coffee filter to cutting up furnace filters and vacuum bags.
Number one, I think if you put those filters in place, they might be hard to breathe through. On the other hand, if I use my usual scarf, my winter scarf, which is quite easy to breathe through, it probably isn't going to be terribly effective. So a lot depends on the material.
Here's how you can make your own face covering in a few easy steps.
Canadian and American public health officials now recommend using 100% cotton material, like an old t-shirt, with elastic bands to create face coverings.
But I always urge people to remember that these are not a substitute for the most important things, which are washing your hands, not touching your mouth and nose, and in general